Okay. My name is Jeanette Long, and this is my health assessment video. This is Leandra. She is my patient. She's 19 years old. Prior to performing her assessment, her height, weight, and vital signs were obtained. Upon entering a patient's room, I would close the door for privacy, then wash my hands. Hello, Leandra. My name is Jeanette. I'm a nurse practitioner student, and I'm going to do an assessment on you today. Is that okay with you?
Yes, ma'am.
Are you experiencing any pain or discomfort?
No, ma'am.
Okay, then I will begin. The patient appears to be in good general health. She is slightly small for her age, but she has good posture. Her skin color is appropriate for her race, and her clothes are neat and clean. Upon examining her skin, it is noted that her skin is intact without any lesions or blemishes, and it is warm and dry. She also has even hair distribution. See your hands? Patient's nails are without cyanosis or clubbing. Starting with their head. Patient's head is shaved. Scalp appears normal. There are no lesions, no deformities. Her head is normal cephalic and atraumatic. Patient's face is symmetrical. Now at this time I'm going to test cranial nerve 7. I want you to frown for me. Then close your eyes. Okay, smile. Pucker your lips. And show me your teeth. Now puff out your cheeks. Very good. Now I will test cranial nerve number 5. Can you clench your teeth for me? Now move your jaw side to side. Very good. Upon inspection of the eyes, her eyelids are intact. The sclera is white, conjunctiva is pink. Okay, look at my nose. Pupils are equal, round, and reactive to light accommodation. Okay, now we're going to test cranial nerve number 4. Can you look at my finger? Okay, now follow my finger without moving your head. Very good. Now, again, I want you to follow my finger without moving your head. This is a test of cranial nerve number 6. Okay, very good. And now, we're going to examine a patient's ears. So I'm going to get my otoscope. With my otoscope, I will look in her ears. First, the right ear. Ear canal is clear. No wax buildup. Eardrum is intact. Pinna is intact. There are no lesions. And now the left ear. Again, ear canal is clear. There is no wax buildup. Eardrum is intact. Pinna is intact with no lesions. And now we're going to test cranial nerve number 8 with the tune and fork. First we do the Weber test. I want you to tell me if you hear this evenly. There we go. Okay. And now the Rhine test. Let me know when you don't hear the sound anymore. Very good. And now we will assess the nose. The nose is symmetrical, there's no swelling, and it is in proportion to her head. Now I want you to cover one nostril for me and exhale, inhale. Cover the other nostril, exhale, inhale. Very good. I will now get my otoscope and inspect your nasal cavity. Okay. Inside the nasal cavity, there are no foreign objects seen. And the septum is midline. Now I will examine your sinuses. I want you to tell me if you have any pressure here when I push.
No.
Any pressure here?
No.
Any pressure here?
No.
Okay. There is no pressure on the sinuses upon palpation. Now we will look into the mouth. Open your mouth for me. Oral mucosa is pink. Dentition is good. Now we will test cranial nerve number 12. I'm going to stick out your tongue for me. And tongue is midline, indicating good cranial nerve 12. Now cranial nerve 10. Please swallow. Very good. And then we inspect the neck. The neck appears supple. The trachea is midline, thyroid is palpable, and there are no lymph nodes that are palpable. Now we move to the chest. Upon examination of the chest, the thorax is symmetrical, the rate and rhythm of breathing is steady, and patient is taking deep breaths. Now I will inspect the posterior chest. Again, chest is symmetrical. There are no evidence of deformities. There are no lesions. And now we will test for respiratory expansion. Take a deep breath in for me. And exhale. Respiratory expansion is symmetrical. And now we will test for tactile firmitas. When you say for me 99.
99.
99.
99. 99.
And one more time.
99.
Very good. Tactile firmitas is good. Now we will percuss the back. We're good. Lung sounds are resonant. Now, we'll auscultate the posterior chest. Breathe in for me. And out. Breathe in. And out. 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 Breathe in. Lung sounds are clear. And now we will test, auscultate the anterior chest. Breathe in and out. And out. And out. And out. One more time. anterior lung sounds are clear. Now, we will test cardiovascular system. First, I will check for pulses, and then I will listen to the patient's heart. Okay, so radial pulses, 2+, 2+ bilaterally, and dorsalis pedis, 2+, and 2+. Now I will listen to her heart. First, using a diaphragm of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. Then I will switch to the bell, aortic, pulmonic, Erb's point. Okay. S1 and S2 are heard clearly. There's no sign of murmurs. Now, we will listen to the PMI with the stethoscope using a diaphragm. Again, S1, S2 heard, no signs of murmurs. Okay, can I have a hand, please? I'm going to test capillary refill. Less than 3 seconds, and a foot. Capillary refill. Less than 3 seconds. Very good. Now we will assess her abdomen. Abdomen is flat, it's non-distended, there are no scars, no lesions, no evidence of a hernia or any rash. I will now auscultate her abdomen for bowel sounds. Vowel sounds are present in all 4 quadrants. And now we're going to do some neurological testing. I want you to touch your nose. Now bring your nose to my finger. Now touch your nose again. To my finger. Okay, back to your nose. Finger. Nose. Finger. Very good. Okay. Now, can you stand up for me? I want you to place your heel on your shin like this. Very good. Okay. Look at me now. Close your eyes and just stand there. Very good. Now I want you to take a couple of steps forward towards the camera. Now turn around. Walk back to the chair. Okay, now walk towards the camera on your heels. Now walk on your toes, tippy toes. Now walk heel to toe. Very good. Can you bend at the knees? Okay, now I will test your reflexes. Right, have a seat. This side's okay. Just relax.
How about that?
Very
I'm always curious.
Relax. If there are no abnormalities with the reflexes. Okay, now we're going to test your range of motion. You raise your arms up for me,
Oh,
both arms. Now back in a circular motion, which I can't do right now. Very good. Now can you put one arm behind your head like this? Very good. Now both hands behind your back. Crisscross your arms in front, up, up, high, and like make your X. Very good. Now open your arms all the way wide. Very good. And can you twist your wrists in a circle? Okay. Now I will test your muscle strength. Lift your arms up like this. Okay. Resist me. Push down as I pull up. Okay. Now resist. Very good. Okay. Now with your knees, push up as I push down. Okay. Down as I go up. And feet, bring them up, down, or yeah. Resist me. Okay. Very good. Good muscle strength. Now we're gonna straighten your knee and back, and the other one and back. And bring out your leg, knee, and wiggle your toes. Oh, wiggle your hands. Very good. Okay, now can I have you stand up, bend over? No. Okay, assessing spine. Spine is without deformity. Okay. This concludes the assessment. Thank you.